Hi all, Dr. Bob here. As many of you know, I take an altered perspective on life and how life works than the way I was educated and the way we continue to educate everyone, because we've become very ingrained in a particular perspective, not only as to how life doesn't seem to work because we don't understand where it came from, but also a perspective where the way to solve all our problems is to take pharmaceuticals that will somehow magically fix whatever's causing our illnesses. I take a very different approach. It's an approach whereby it's the flowing energy, God, that creates everything, and that manifests itself as what's known as flow dependent structures, uh, basic concepts of organization coming out of disorder as a function of flow, as developed and pioneered and elaborated by Nobel laureate Ilya Prigogine. So, what I've done is I've extended his concepts where flowing energy is creative. And rather than leaving that in the realm of physics, I've been able to embrace that perspective and really translate all of the biology that I was misunderstanding, which was all of the biology I knew, into a very radically different perspective. Radically is a good word because it's all based on free radicals and how free radicals really are the most fundamental homeostatic agents in living systems, and they regulate the flow. So we need free radicals because the damages that they create in everything within our cells and between our cells serve as signals that modify the flow in such a way as to minimize excess free radical production, which becomes harmful because it's more than the system can tolerate. And we need the electron energy flow in general because that's how we make our energy. So we have to balance danger and efficiency with basically safety and resurrection, fixing, recycling. It turns out that carbohydrate metabolism fosters our movement into the future and is regulated by the CB1 receptor. And fat burning is really going back and fixing problems as they occur and after they've occurred so as to minimize their future consequences of having these imbalances in the flow. It's the distance from equilibrium, the complexity of our biochemistry that is our health. So we have now a physics-based definition. So the reason understanding all of this is very important is that because whenever a cell needs to really accomplish something, it typically will use this efficient means of energy production, the electron transport system, which is a major source of free radicals, which underlie aging and all age-related illnesses, not from a static perspective, which is the errors of the past, but from a dynamic perspective, considering us as like a pyramid of interacting flow-dependent structures, ranging from everything physical within us to everything mental, and then expanding beyond that to our society, our financial systems, our healthcare systems, etc. So the problem is we have not been educated to understand this creative nature of the flow and how the flow always works by balancing opposing flows. And the general opposing flow that is always balanced is the ability to create things and then having to fix the mess and clean up the mess that you made when you were creating. So that turns out to be what happens with fat burning when we turn on autophagy, and that's what the CB2 receptor does. So when you balance damage with production, everything is cool. Now, the problem that we're facing today is the coronavirus. It's apparently relatively new, and we have fairly low resistances to it because we haven't had a lot of this particular virus, which is a little strange in part because of how common coronaviruses are for respiratory infections. You'd think we'd have a little bit more kind of resident immunity in our the flow of humanity. It's not quite as bad, it seems, as when the Indians were first exposed to smallpox, because it still is very regionalized in terms of severe consequences. And, we don't even ask the right questions. I mean, why are all these old men in China dying? Is it because they're cigarette smokers? Is it because they're overweight? Why do they have heart conditions, cancer, etc.? For all people, it has a lot to do with fundamentally consuming too many carbohydrates and not recycling enough of yourself to maintain yourself in a healthy state. Which brings us now to a number of peer-reviewed scientific articles that clearly and unambiguously show that the coronavirus lands, so to speak, on a cell, because the first thing a virus has to do, it has to bind and get into the cell. And that's how it then gets its genetic material into the cell, which in this case is a positive stranded RNA virus that can immediately bind to ribosomes, which are basically the factories that produce proteins. So in this case, the protein factories are being told to produce viral parts rather than the parts essential for your cell's survival, which of course is disruptive and will generate excess free radicals. But many viruses have what's called VIFs, viral infectivity factors, that actually wind up regulating free radical production so that the cells will not undergo apoptosis. And again, apoptosis occurs when you amplify imbalances, and that amplification is done via the electron transport system. So you don't really get apoptosis when a cell is burning fat. It can then still blow up if it can't generate enough energy and burst open, but it's a slightly different mechanism, and it has different consequences, very different consequences, because of inflammation. And when you burst open a cell, it's like you turned on all of the intracellular telephone calls that were going on as the chemistry was flowing in harmony, psychedelic harmony with the whatever the cell was doing. And now all of a sudden, all of those communicants, the cellular goo, is now blah, and it's talking to everybody, saying everything, and they're all doing it. Every cell is breaking. So it's like having everybody in the world on a party line. You can't communicate effectively, which means you can't organize, which means you can't be healthy, which potentially means you'll die as imbalances are amplified to cause, in the case of respiratory infections, what's known as ARDS, adult respiratory distress syndrome. And it's all caused by an amplification of imbalances, and in particularly by the carbohydrate burning mechanisms of a cell. So what's the solution? Turn on fat burning. All the Chinese and all of the Sanskrit and all herbal medicines that were evolved because they worked, not because the FDA approved them or because they were advertised. They worked. Word of mouth, all of them for cancer, Alzheimer's, diabetes, they all turn on fat burning. So we know that plantaceuticals have had such an impact that they were able to be observed in everyday life to be functional and beneficial in everyday life. Not in some clinical setting where we tested blah, 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 blah. We got, FDA approval. Nonsense. So where are we now? We are left with the fact that cannabis via the CB2 receptor, as well as countless nutraceuticals, have benefits for human health because they turn on fat burning and or turn off sugar burning. They're usually kind of very reciprocal relationships. When you turn on fat burning, that turns off sugar burning. Unless you take so much sugar, then that's the preferred source. And then you can still be burning maybe a little fat because you're trying to protect yourself from all the free radicals, but you're still overloading the system with too many free radicals. So the net effect is a decrease in the organization, the flow, and hence a movement towards equilibrium, which is cell death or organismic death or societal death, because they're all dependent on the flow. Okay, so coronavirus, turn on fat burning, because the ACE2 receptor, which is the landing pad for the virus, is dependent on fat burning, because the enzyme that breaks that down turns on fat burning. So you want to be able to do that, and therefore minimize not only the ability of that infected cell to replicate more, but for other cells to then be infected and to replicate, because they're basically depriving the virus of its fuel. And a car can't run without its fuel. You can't run without your fuel. And neither can a virus make little babies without its fuel. So learn. There are numerous scientific articles. I will show them separately because I can't seem to integrate my screen with this screen, but I will try afterwards. So eat right. You are what you eat. Cannabis is an excellent way of turning on fat burning. CBD does it as well by virtue of inhibiting CB1, as well as by turning on certain other things and turning off certain things that in general is quite beneficial. You'll lose weight if you're overweight. If you're overweight, it's because you're making too many free radicals. Your body is trying to protect you by turning it into fat. And listen to your body. You don't want that fat. You want muscles. That's far from equilibrium. Fat is like trying to survive while you're drowning. Bye. What I'm showing you here is my database, which comes from a program called Bookends. And this is the search portion of the engine of the database. These are the terms that I searched, and I searched PubMed. And when you search these terms, you come up with these programs. They're highlighted in yellow because that means I already brought them into the actual database. So I just wanted to show you how this is very critical for us to understand how to protect ourselves from the coronavirus that's occurring this time, as well as other viral infections in general, but this one in a very specific manner where we can trace really the mechanism as to why turning on fat burning and staying away from carbohydrates will have a very beneficial effect by virtue of inhibiting, on one hand, the spread of the infection by making cells resistant to infection, but also by inhibiting the developmental process. Assuming the virus was able to get into the cell and then replicate, this would actually inhibit the replication within because of the nature of the sugar burning metabolism that is required by viruses during that particular phase of their life cycle, during that replicative synthetic phase where they have to make more of their components. So here, if we just look at the names, AMP, activated protein kinase phosphorylation of angiotensin converting enzyme 2 in endothelium mitigates pulmonary hypertension. Pulmonary hypertension is when you have high blood pressure between your lungs and your heart. And angiotensin is an enzyme that, in fact, blood, tension, pressure. It's involved in creating blood pressure. But there's an enzyme that converts angiotensin. And in doing that, it relieves the high blood pressure. And that conversion is regulated by AMP kinase, which is the main factor that one looks at, that I always use when I want to determine how a particular anything is working. Because AMP kinase, when it's activated, is when it in turn turns on fat burning by multiple mechanisms in multiple dimensions. But this is a critical player, although not always the only player, and sometimes there are other routes around it. But the key point here is that fat burning will turn off the carbohydrate metabolism, and that in this case it does that by activating AMP kinase to phosphorylate the angiotensin enzyme 2. Now we can just go to other things. So angiotensin, when it's broken down partly, can form a peptide component, angiotensin 1 through 7, and that stimulates brown fat. So the original angiotensin, which turned on sugar burning, is broken down to a fragment which then makes brown fat. Brown fat is what your body burns to keep warm, hence reduces dietary induced obesity. It's a mechanism of fat burning. So the compound that started off dangerous by too much sugar burning and causing high blood pressure, gets broken down and turns on fat burning. Now we go to the next one. Angiotensin enzyme, converting enzyme 2 overexpression protects against oxorubin-induced cardiomyopathy by multiple mechanisms in rats. Well, once again, we're just looking at the titles here, and already we can see something significant. Cardiomyopathy, that's, basically the heart is not happy, it's unhealthy, all right? And doxorubicin is a chemotherapeutic drug, and it works by causing excess free radicals, and that's why it damages the heart. All right? So angiotensin converting enzyme 2 overexpression protects the heart. Well, that's what converts the angiotensin into the 1,7 that turns on fat burning. So once again, we're seeing fat burning, in this case, protecting the heart. We go to the next one. 1,7 improves non-alcoholic steatohepatitis through an adiponectin-independent mechanism. All right, what does that mean? Angiotensin 7, that's the one that turns on fat burning, improves non-alcoholic steatohepatitis. What is that? Steatohepatitis is when your liver is depositing too much fat, and it's clogging up the little collecting channels that are part of how the liver works. And it does it through an adiponectin-independent mechanism. Well, adiponectin is like it's one of these fat-produced mediators. So it's telling you that's doing by a mechanism independent from that. This ties in very much with the cannabinoid system. That's a whole other story. So here we go. ACE2 deficiency worsens epicardial adipose tissue inflammation and cardiac dysfunction in response to diet-induced obesity. So that's telling you when you eat too many carbs, because that's what the body makes into fat to protect you, that ACE2 deficiency worsens the epicardial adipose tissue inflammation because you're not turning on fat burning. Too much sugar. Crosstalk between angiotensin 1,7 and the max axis and sirtuins in adipose tissue and metabolism of high-fat-fed mice. Well, sirtuin, these are proteins that are involved in fat burning because they turn off sugar burning. They are a class of histone deacetylases. They don't only deacetylate histone, but they deacetylate in particular histone, which changes the architecture of the chromosome so that you're turning off the sugar burning and leaving on the fat burning. So it's got tremendous protective abilities. And this is showing you that by having the angiotensin 1,7 function, that breakdown of the angiotensin, that's now turned into something good and helpful. And this is the receptor through which it's working. And it's doing that all by turning on fat burning. And then we go to the heat shock. Heat shock prevents insulin-resistant induced vascular complications by augmenting angiotensin 1,7 signaling. Well, what's going on here? Heat shock. When you heat proteins up too much, they denature and they don't function properly, and they're recognized by various classes of proteins that will then, the heat shock proteins, will then activate various salvage pathways to try to refold them or to break them down and recycle them. So once again, insulin-induced vascular complication. Why? Because the insulin is bringing sugar into the cells that the cells are then burning and then producing excess free radicals. So people with diabetes, what are they doing? They're taking insulin to force more sugar in when the reason they have type 2 diabetes in the first place is because they were poisoning their cells with too much sugar, and the cells said, stop killing me, I'm not going to eat any more of your sugar, and they turn off the transporter. But the wise professional doctors say, we'll fix this, we'll make it so you can take it in more, we'll give you an insulin shot. This is all retarded thinking. But nevertheless, you can see how we've tied together all of these fundamental biochemical phenomena having to do with viral entry, viral replication, having shown how fat burning can turn all of that off, and how we should be turning on fat burning to protect us from the coronavirus. And we've done similar things with high effectiveness for controlling HIV, Kaposi sarcoma, and for me personally, I've done it with influenza in the past when I had it years ago. I don't have it anymore because I do this kind of metabolic manipulation. Take care.